Welcome and thank you for joining us. Today we'll explore two significant ocular conditions, diabetic retinopathy and optic nerve atrophy. We'll delve into their underlying mechanisms from both Western medical and traditional Chinese medicine perspectives and discuss integrative treatment approaches utilized at our clinic.
Diabetic retinopathy is a complication of diabetes that affects the eyes. It's caused by damage to the blood vessels of the light-sensitive tissue at the back of the eye, the retina. Over time, high blood sugar levels can lead to the blockage of these tiny blood vessels, cutting off blood supply to the retina. In response, the eye attempts to grow new blood vessels, but these new vessels don't develop properly and can leak easily.
Key points. Stages of diabetic retinopathy include non-proliferative diabetic retinopathy, the early stage where blood vessels in the retina are weakened, and proliferative diabetic retinopathy, the advanced stage characterized by the growth of new abnormal blood vessels. Complications can include macular edema, which is swelling in the central part of the retina, neovascularization, the growth of new fragile blood vessels, and retinal detachment, where scar tissue can pull the retina away from the back of the eye.
Optic nerve atrophy refers to the damage or degeneration of the optic nerve, which transmits visual information from the eye to the brain. Causes include poor blood flow, known as ischemia, inflammation, or trauma. In conditions like glaucoma, increased intraocular pressure can damage the optic nerve fibers.
Key points to look out for include decreased visual acuity, visual field defects, and color vision deficits. For diagnosis, visual field testing assesses peripheral vision optical coherence tomography, or OCT, provides imaging to view the optic nerve head and visual evoked potentials, or VEP, measure electrical activity in the brain in response to visual stimuli.
Both DR and ONA are closely linked to circulatory health. In DR, high blood sugar levels damage retinal blood vessels, leading to leakage and poor oxygen supply. In ONA, inadequate blood flow can result in optic nerve damage. Maintaining healthy circulation is crucial for preventing and managing these conditions.
Traditional Chinese medicine, or TCM, offers complementary approaches to managing diabetic retinopathy and optic nerve atrophy. Through centuries of clinical observation and modern validation, acupuncture and Chinese herbal medicine have demonstrated measurable effects on circulation, neuroregeneration, and vascular health.
Physiological effects of acupuncture on circulation and nerves research. Summary. Studies have demonstrated that acupuncture significantly increases peripheral blood flow through vasodilation and neurovascular regulation, mediated by nitric oxide release and autonomic modulation. The increased perfusion improves delivery of oxygen and nutrients to ischemic tissues, such as the retina and optic nerve. In a randomized trial, patients receiving acupuncture showed improvement in visual acuity, contrast sensitivity, and visual field. Researchers concluded that acupuncture may stimulate regeneration of optic nerve fibers and improve microcirculation. Effects of Chinese herbs on circulation, diabetes, and retinopathy research. Summary. Herbal formulations such as danshen, honghua, and qishao were found to dilate retinal blood vessels, reduce platelet aggregation, and improve hemorrheology. These effects help reduce microvascular complications of diabetes, including a population-based study in Taiwan, showed that patients with type 2 diabetes who used TCM had a significantly lower incidence of diabetic retinopathy. Herbs like huangqi, astragalus, and shanjia, hawthorn, were frequently used to enhance microcirculation and reduce blood glucose.
In Chinese medicine, we don't just treat the eyes, we treat the systemic patterns that prevent the eyes from being nourished properly. These include diabetic retinopathy patterns. 1. Liver and kidney yin. Deficiency with empty heat, signs, dry eyes, blurry vision, red cheeks, night sweats. Treatment. Nourish yin, clear heat. Formulas: Liu Wei Di Huang 1, Zhi Bai Di Huang 1. 2. Qi and blood deficiency. Signs: pale complexion, fatigue, blurry vision, floaters. Treatment: tonify qi and nourish blood. Formulas: Bajantang, Buzhong Yi Qi Tang. 3. Blood stasis in the eye. Collaterals: signs: sharp eye pain, dark spots, visible hemorrhages. Treatment: move blood, break stasis. Formulas: Sui Fu Zhu Yu Tang, Tong Qiao Huo Xue Tang. Optic nerve atrophy patterns. 1. Liver blood deficiency, failing to nourish eyes. Signs: blurred vision, dizziness, dry eyes. Treatment: nourish liver blood and brighten vision. Herbs: Guqizi, Lycium, Dangui, Angelica. 2. Kidney essence deficiency. Signs: gradual vision loss, weak knees, tinnitus. Treatment: tonify kidney essence. Formulas: Zuogui 1, Yugui 1. 3. Phlegm, damp blocking orifices. Signs: cloudy vision, heavy limbs, foggy thinking. Treatment: transform phlegm, open orifices. Formulas: Wen Dan Tang, Ban Xia Bai Zhu Tian Ma Tang.
Studies have shown that microcurrent stimulation can increase ATP production, reduce inflammation, and promote nerve repair. In ophthalmology, it is used to improve electrical signaling within the optic nerve and retinal neurons, which is particularly beneficial for optic nerve atrophy and ischemic conditions.
From a TCM perspective, vision is only as good as the blood and fluids that nourish the eye. If the liver, kidney, and spleen systems are compromised, the eyes will be undernourished, even if structurally they're intact. That's why our treatments target the body's core imbalances first to rebuild proper circulation and vitality, which can then be delivered to the visual system.
If you or a loved one are experiencing vision issues due to diabetes, poor circulation, or optic nerve damage, don't wait. At Makari Wellness, we use proven integrative approaches that go beyond symptom management. Visit makariwellness.com to learn more and discover how acupuncture and herbal medicine can help restore and protect your vision.